which means this thing is widespread. That's the good news. We've seen 1,227 deaths in the state of California with a possible incidence or prevalence of 4.7 million. That means you have a 0.03 chance of dying from COVID-19 in the state of California. 0.03 chance of dying from COVID in the state of California. Does that necessitate sheltering in place? Does that necessitate shutting down medical systems? Does that necessitate people being out of work? So that's California, and that's. I also wanted to mention that 96% of people in California who get COVID recover with almost no significant sequelae or no significant continuing medical problems. So those are important statistics for the state of California. 2 months ago, we didn't know this. So I'm going to bring it to light now because we're sharing our own data. This isn't data filtered through someone. This is our own data. We found 6.5%, and then California has found 12%. So the more you test, the more positives you get, the prevalence number goes up, and the death rate stays the same. So it gets smaller and smaller and smaller. And as we move through this data, what I want you to see is millions of cases, small amount of death. Millions of cases, small amount of death. And you will see that in every state. And since we're talking about following the science, we're going to follow the statistics and follow the science. So I want to look at New York State. They've been in the news a lot, right? And their numbers are critical. Let's go over their numbers. Cases of COVID as of yesterday, 256,272 cases in New York State. Not New York City, New York, the entire state. But they did a total of 649,325 tests. That's 39% of New Yorkers tested positive for COVID-19. That's their ratios. This is public data online. You can all look it up. 39% of the people were tested.
39% of New York State.
Right.
39% of New York State is there's 20 million people there would be close to 4 million.
Which is they likely have 7.5 million cases
So
in
I
New
just want
York.
to make that clarification. It's
Yeah.
not 39% of every New Yorker. It's every New Yorker who's been tested.
Right. So we extrapolate data.
I just want to make that.
We extrapolate data, we test people, and then we extrapolate for the entire community based on the numbers. The initial models were so inaccurate, they're not even...
But in those initial models, a lot of them were based off if we did no social distancing.
Right.
Is that correct? So is it really fair to say, obviously they're not as bad as they were because those were based on alternative scenarios?
And some of them were based on social distancing and still predicted hundreds of thousands of deaths, which has been inaccurate. So in New York, the ones they tested, they found 39% positive. So if that's indicative, and they tested 649,000 people, that's a massive test. That's accurate data, 39%. So if they tested the whole state, would we indeed have 7.5 million cases? We don't know. We will never test the entire state. So we extrapolate out. We use the data we have because it's the most accurate we have versus a predictive model that have been nowhere in the ballpark of accurate. So how many deaths do they have? 19,410 out of 19 million people, which is a 0.1% chance of dying from COVID in the state of New York. And they have a 92% recovery rate. If you are indeed diagnosed with COVID-19, 92% of you will recover. So we're seeing millions of cases, small amount of death. Millions of cases, small amount of death. And the reason I'm making that point is because we're going to compare this to flu and say, is this significantly different from influenza A and B? And if not, why has our response been what it is? USA, this is a big one for us. 802,590 cases as of yesterday. We've tested over 4 million. If you guys have studied globally what's happening, that's double what any other country. Germany's at 2. I realize their populations are lower, but the fact that we were able to ramp up and do 4 million is pretty impressive, which gives us a 19.6% positive out of those who were tested for COVID-19. So if this is a typical extrapolation, 328 million people times 19.6 is 64 million. That's a significant amount of people with COVID. It's similar to the flu. If you study the numbers in 2017 and 2018, we had 50 to 60 million with the flu. And we had a similar death rate. The deaths in the United States were 43 1,545. Similar to the flu of 2017, 2018. We always have between 37 and 60,000 deaths in the United States every single year. No pandemic talk, no shelter in place, no shutting down of businesses, no sending doctors home.
That's from the flu, by the way, just to clarify.
Yeah.
37